Every time you go to the doctor, a story gets written about you. But here's the thing. It's not in English. It's in a code, a secret language that, believe it or not, runs pretty much everything in healthcare. And today, we're going to crack that code.
Have you ever seen something like this on a medical form? That S00T.T8. I mean, it just looks like total gibberish, right? Some random jumble of letters and numbers, but trust me, it is anything but random. That little code, it's actually a word. A really, really specific word in a kind of secret language that connects doctors, hospitals, insurance companies, even researchers all around the world. It's the language they use to tell the story of your health.
And just like any language, it has rules. A grammar book, if you will. And we're going to peek inside its official grammar book. We're talking about the ICD10CM official guidelines. This is the actual document that medical coders live by every single day.
Okay, so what is this system really? And who's behind it? Who gets to make all these incredibly important rules? All right, its full name is a bit of a mouthful. The International Classification of Diseases, 10th Revision, Clinical Modification, or ICD10CM for short. The easiest way to think about it is like a giant encyclopedia of, well, everything that can happen to a human body. It's the system they use everywhere in the US to classify every single diagnosis, every reason you might see a doctor. A cold? It's got a code. Super complex surgery? Yep, it has a code too.
And get this isn't just some friendly suggestion or a best practice. It's the law. These guidelines are actually required under HIPAA, the same big federal law that protects your medical privacy. So yeah, getting these codes right is a very big deal.
So who are the keepers of this secret language? It turns out it's a team effort between 4 major organizations. We're talking about groups representing hospitals, health information experts, and big government agencies like Medicare and the National Center for Health Statistics. Together, they make sure these codes are accurate and useful for everything.
Okay, now for the really cool part. Let's actually dig into the grammar of this language, because it's surprisingly logical and honestly, it's kind of fascinating.
So, a good language needs to make sense, right? It needs rules to stop you from saying something that's impossible. And this code has them. Check out these things called excludes notes. The excludes one note is basically a giant stop sign. It screams, "Not coded here." It means a patient can't have both of these conditions at the same time, period. Then you have excludes two. This is more like a yield sign. It's saying, hey, this condition isn't part of the first one, but a patient could totally have both. See? It's all about pure, simple logic. And this logic is baked right into the language. Take a simple word like with. In the world of medical coding, that one little word is incredibly powerful. The guidelines say it automatically implies a cause and effect relationship. So if a coder writes diabetes with kidney disease, the system just assumes the diabetes caused the kidney problem. Even if the doctor didn't write it down that way, that one word changes the whole story.
So to give you a sense of just how massive this thing is, let's do a quick flyby of the codebook itself. The whole universe of human health is broken down into chapters.
So you've got Chapter 1, which covers all the infectious and parasitic diseases. Think everything from the flu to malaria. Then there's Chapter 2. That's all about neoplasms, which is the technical term for cancers. Every type, every location, all in there. We can jump way ahead to Chapter 15, which covers everything related to pregnancy and childbirth.
Or Chapter 19, that's where you'll find all the codes for injuries, poisonings, all the consequences of things happening to you.
And right after that, Chapter 20 gets even more specific. It's all about how those injuries happened. Was it a fall, a car crash? There's a code for it. All in all, there are 22 of these chapters. 22. They systematically cover pretty much any condition, any symptom, any circumstance you could possibly think of. And the level of detail is just wow. I mean, look at this. I pulled this quote straight from the guidelines. It says that for injuries you get during a hurricane, you use a specific code, X37.0-. A hurricane. There is literally a code for injuries sustained in a hurricane. It just shows you the system is trying to capture the full picture, not just the biology.
All right, so it's incredibly detailed, it's super comprehensive, and it's required by law. But, so what? Why should you actually care about any of this?
I mean, really, why go through all this trouble? Why create this massive system with hundreds of thousands of codes for every little thing?
Well, that one little code is doing a ton of heavy lifting.
First off, it's what tells your insurance company what to pay for. It's the foundation of your bill. Second, it's absolutely vital for public health. It's how officials can spot an outbreak of the flu or something more serious in real time. Third, it creates all this standardized data that scientists and researchers all over the world use to make medical breakthroughs. And fourth, all of that data helps lawmakers and health organizations decide where to put their money and attention. It guides health policy.
You see, it's this invisible framework that takes your one single trip to the doctor and turns it into a piece of usable global knowledge. It connects your personal health story to the health of millions of other people.
So, the next time you see one of those strange little codes on a medical bill, you'll know what's really going on. It's not just some random number for billing. It's a word in a powerful secret language that's telling a story. Not just your story, but a small piece of a much, much bigger one. So what story will you see hidden inside it?